Hello everybody, this is Dr. Santosh HS. I am a consultant endocrinologist at Malathi Manipal Hospital, Jayanagar. So I today will be talking about myself and a couple of things that I do here at Malathi Manipal. So I graduated in 2000, did my undergraduation from Bangalore, and following which I emigrated to United Kingdom, were trained in the Wales Deanery, where I got my endocrinology degree, did research at Liverpool, and followed by a stint at the Edmonton, which is the premier institute for islet cell transplantation, which is usually required for patients with type 1 diabetes. Now, as an endocrinologist, you probably would have understood that we deal with hormones of the body. So, most of us kind of are consulted with regards to problems regarding blood sugars or diabetes. So, diabetes itself can occur at any age. So, it can be as early as a newborn and as late as a 50 or 60-year-old. So, the most important thing to understand is most often diabetes is regarded as a lifestyle disease unless it is occurring in the early ages. So, diabetes needs a fundamental change in the way we lead our lives. So, this needs to be understood and explained to everybody who is suffering with diabetes so that we can eradicate it. So, it is a bit of a bigger statement when we say eradicating diabetes, because at the moment we have learned how to control it and not cure it. But the people who have successfully adapted good and effective lifestyle practices have managed to get rid of the diabetes in their lives and have needed to use very minimal medications or no medications. But this is the effort that one as a patient and as a clinician we put together as a team. So, this is very essential, and this is something that needs to be done not just by changing your diet, not just by increasing your exercise, but also changing the amount of stress in one's life and adapting new ways of to deal with the commonly encountered problem in life. The other commonly encountered hormone problem is the thyroid illness. The thyroid illness is most commonly either an underactive thyroid, which is called as hypothyroidism, or hyperthyroidism. Hyperthyroidism where the thyroid is overactive. So, the thyroid is a very important organ of the body which makes hormones. So, it can be easily described as a spark plug of the body for people who drive cars and bikes, because without the spark plug no amount of petrol will get your engine to run. So, similarly no amount of food that we eat is enough to make the energy in your body. So, it is very essential to burn the food that we have eaten and convert it into the energy that is required to carry out the daily activities. So, if you were to imagine a situation wherein there is not enough energy, then obviously we are very tired, can't carry out our daily activities. Most people with an underactive thyroid, that is hypothyroidism, do gain a lot of weight and they have very poor appetites, and women especially have a lot of problems with their periods and have difficulty to conceive. So, thyroid problems, especially the hypothyroidism, are very easy to treat, and it would be important that you see an endocrinologist to understand the nature of the thyroid problem, and a simple tablet which has got literally no side effects can fix the issue. The next commonly encountered problem is an overactive thyroid, also referred to as hyperthyroidism, wherein an overactive thyroid would cause every cell in the body to go on an overdrive. It is pretty much that you are running a constant marathon. So, you are going to lose a lot of weight, you are constantly being sweaty, your heart rate increases significantly, and women have little or no periods at all. In these situations, the patients experience a lot of distressing symptoms, and it is very important in the context of an unexplained weight loss to also consider seeing an endocrinologist for a possible thyroid problem. So once we can diagnose the thyroid problem, there are some types of thyroid diseases which can be treated with tablets alone, and some other forms which might require a very short duration of steroids. So, but if you consult your friendly endocrinologist, they can perhaps guide you along the right pathway, tell you about the right set of tests that need to be performed, and help you fix or get to the bottom of the problem. The other common problem that one tends to face is disorders of the calcium, bone, and most of the doctors refer to as the parathyroid problems. So in life, the calcium is usually hidden in the bones of the body, and it is very integral for the strength of your bones. If your bones gradually get thin, then you are likely to suffer from fractures with very slight trauma. Trauma in the sense, if you have even the slightest fall or slightest injury can make you prone to fractures. So this is commonly encountered in women who have stopped having their periods at the ages of above 48 to 50, and they have had no help with regards to or have never been counseled with regards to their bone health. In this situation, the bones tend to get severely thin, and they can suffer with fragility fractures. The parathyroid helps regulate the bone strength in many occasions, and these are 4 glands at the back of the thyroid gland in your neck, which dictate how the bone strength should be in your body. So this again falls in the purview of an endocrinologist to help you understand the calcium related problems or the bone strength, so that you can concentrate at the tail end of your lives when you have really decided to retire and be happy with spend more time with your family. You don't want to kind of end up having a fracture and spend time at the hospital. So endocrinologists do help in assessing your bone strength and the well-being of your skeleton. The other 2 endocrine organs which are very important and crucial in life are the pituitary and the adrenal glands. The pituitary is an organ which is sat at the middle of or the bottom of the skull, and it is very important in regulating all the hormones of the body. It is called as the master endocrine organ, and it sends messages to the thyroid, to the adrenal glands, and the male organs of sexual health to successfully work or maintain health. So if for a reason the thyroid, the pituitary is not working well, then people can become extremely tired, have a very low blood pressure, and it could end up in a situation where the salt levels are significantly low, and could be dangerous to one's life. The pituitary problems are usually seen in people who have had surgeries that belong to the brain, so radiation to the skull for various tumors. So in these situations, people over a period of time can have lack of hormones, which can give rise to various effects like the ones that I described earlier. The other more important context in which pituitary problems can occur is in people who have got unexplained headaches or problems with the vision, who also experience a significant amount of lassitude or tiredness and haven't got the energy to complete anything that they do, and have a very low blood pressure. In these situations, evaluation of the hormone profile, which might suggest a pituitary problem, would be beneficial before undertaking specific tests to take pictures of the brain to look at how the pituitary is. The other important organ that I have already mentioned is about the adrenal gland. If the adrenal glands are not working properly due to any cause, then people suffer with extreme dizziness, especially when they stand up, extreme tiredness, and they are usually found to have a very low salt level in their blood. So again, these conditions need to be appropriately diagnosed at a very early stage to save patients from suffering chronic bad health, which could even be life-threatening, as explained before. Now, the other main problems is with the reproductive health, especially women who struggle to have regular periods, who are struggling to conceive. These women are now commonly referred to as suffering with polycystic ovarian disease. The polycystic ovarian disease is also a part of the endocrine system, and there are appropriate evaluations and tests that can be done to identify the problem and treated with great ease with minimal lifestyle interventions and some medications that could be required. In men, however, the sexual dysfunction, especially with regards to lack of the male hormone concentrations, is a common endocrine problem. Men have problems with erections, lack of libido, which is the interest in having the sexual activity, and unexplained hair loss and change in their moods, and extreme tiredness and irritability. Now, these symptoms hail the occurrence of a male hormone deficit, and it's usually easy to identify the cause of this by doing some simple blood tests, after which treatment could be initiated. It is very crucial for you to see an endocrinologist so that we can help you and hold your hands towards recovery and get there more quickly, get to recovery more quickly, and do not allow your symptoms to wear you down.